NREMT practice question number 1. A 60-year-old female is confused and lethargic. A family member tells you that she has been experiencing abdominal pain for the last 5 days that has been accompanied by nonstop vomiting and diarrhea. Her vital signs are pulse 134, respiratory rate of 20, blood pressure 92/70, and SpO2 of 91% on room air. You should A. Administer oxygen via nasal cannula, lay them supine, and rapidly transport. B. Administer oxygen by non-rebreather, lay them supine, and rapidly transport. C. Assist the patient's ventilations with a BVM, administer oxygen, and rapidly transport. Or D. Place the patient in a position of comfort and rapidly transport. If you need more time to review the question, pause the video now. The answer will be revealed in 3, 2, 1. And the answer is administer oxygen by non-rebreather, lay them supine, and rapidly transport. Let's break it down. A 60-year-old female is confused and lethargic. The first thing that you should put together is that you're dealing with an adult female with confusion and lethargy, which are significant and serious symptoms. It also says a family member tells you that she's been experiencing abdominal pain for the last 5 days that has been accompanied by nonstop vomiting and diarrhea. These details are important as they point to a patient who has been sick for several days, and since we know they've been vomiting and had diarrhea for 5 days, they're probably dehydrated. Her vital signs show an elevated heart rate, a respiratory rate on the higher end of normal, a low blood pressure, and a low oxygen level. After reading this question, but before you even looked at the answers, you should have noticed that all the details when combined indicate that the patient is experiencing hypovolemic shock. Using your critical thinking skills again, you should have also recognized that the question is asking, what should you do for a patient who is in a state of shock? And of course, the answer is to administer oxygen by a non-rebreather, as their oxygen level is low and they're in a state of shock, so they're going to need high-flow oxygen. Lay them supine. Since their blood pressure is low, we want to help their body not have to work as hard to perfuse blood, and laying them supine will help with that. And we want to rapidly transport them. We want to get the patient to the hospital as quickly as we can because the patient is considered to be critical. Now let's go over the wrong answers. A is wrong only because of the first answer, which is administer oxygen via nasal cannula. Based on the low oxygen level and the fact that the details indicate the patient is in a state of hypovolemic shock, high flow oxygen is appropriate. But oxygen via nasal cannula, which is used for low flow, not high flow oxygen, would not be sufficient enough. C is wrong only because of the first answer as well. Although the patient is in a state of shock and the respiratory rate is on the high end of normal, there's no indication that the patient is breathing shallow or that the patient needs assistance with ventilations. Lastly, D is wrong because the patient has a low blood pressure and a low oxygen level. Placing them in a position of comfort and transporting them without first treating them would not be appropriate. So again, proper treatment for this patient who is experiencing a state of hypovolemic shock would be to B. Administer oxygen by a non-rebreather, lay them supine, and rapidly transport. If you found value in this video, make sure to give it a like, and for more NREMT practice question videos just like this, make sure to visit and subscribe to our channel. And if you're looking to pass the National Registry Cognitive Exam yourself, make sure to visit our website, howtonremt.com, to get your membership today. With our membership, you'll get lifetime access to a free practice app that has hundreds of questions that mirror those on the National Registry exam. 1 year of unlimited live group tutoring with an instructor who will teach you exactly how to pass the National Registry exam, access to our videos and content, and of course, your membership will be backed by our 100% guaranteed to pass or 100% money back guaranteed policy. So again, make sure to visit howtonremt.com now to get your membership, and don't forget to use code DOMINATE at checkout.